Okay, welcome everyone. Thank you for joining us. Today we are meeting on the topic of beyond meeting them where they're at, how nursing students conceptualize harm reduction. This is presented by Dominique Denis-Lalonde, who is a master's prepared registered nurse and educator in Calgary. Her thesis work focused on conceptualizing harm reduction in nursing education and practice. Her background is in harm reduction and safer drug use, HIV prevention, sexual health, and sex worker advocacy. She's also currently a nursing instructor with the University of Calgary and teaches community and population health promotion with a harm reduction lens. I'll pass it over to Dominique and we'll get started.
Great, thank you, Megan. I'm so excited to be here. I'm gonna just go ahead and share my slides because it might take a minute to load. And if everyone can just remember to mute their mics, that would be super helpful. Thank you. So first, I want to just situate myself both geographically and in relation to this topic. So I have the privilege to work, live, and raise my family on Treaty 7 territory, which belongs to the Blackfoot peoples. So that's the Siksika, the Piikani, and the Kainai, the Tsuut'ina, and the Stoney Nakoda, which includes the Chiniki, Bearspaw, and Goodstoney. The city of Calgary, or Mohkinstsis, is also home to Métis Nation Districts 5 and 6. And I myself am a descendant of French settlers who were both pioneers and colonizers. So in the spirit of reconciliation, I'm grateful to live in this beautiful place, and I will continue to humbly learn from those who were here long before my ancestors and those who are still here now. So have all these things up. Okay, so that's where I'm from. But in addition to this, I also identify as a nurse, an educator. I'm a parent of 2 young kids, and I'm a person with lived experience of substance use. My interest in harm reduction and theory stems from over 2 decades of personal and professional experience with drugs and with the people who use them. So in 2019, just before the pandemic, I actually did a webinar for HRNA where I shared a concept analysis of harm reduction. And so I'm so grateful for HRNA to have me back to talk about my research. It's always nice when people want to hear about your research. So once again, I'll be focusing a bit more on the theoretical side, but hopefully also providing some practical applications for educators in various settings. And I know there's quite a few on this call, so hopefully you get something valuable from it. Let's see here. So this is what we're going to do today. I do want to focus most on the findings and their implications, of course, but I'll give you some details about the study design to provide some context. And also, these are some acronyms here that, if you're not familiar with, I will be using quite a bit in this presentation. So, to provide some context for my research, let's consider what we know so far about nursing practice and harm reduction. So I don't think, I think I'm preaching to the choir here, that I don't need to talk about the importance of harm reduction, but we know that harm reduction strategies reduce mortality and comorbidities for people who use. Whether it's safe supply, supervised consumption services, or distribution of sterile equipment. We also know that harm reduction is a concept that gets people really fired up, both on the positive side and not so positive. It's a really loaded topic, and how harm reduction is defined also differs as well. I think we can all agree that that people who use drugs exist in all socioeconomic levels and populations. So RNs will be caring for people who use drugs regardless of where they end up working. And lastly, the reality of the opioid crisis and the harm of a toxic illegal drug supply indicates that nurses can help reduce risk associated with drug use, but they're going to need to be adequately prepared to do so. So on the right here, in their 2015 mental health and addiction competencies document, CASN, so the Canadian Association of Schools of Nursing, has included 2 entry to practice competencies that refer to harm reduction. So being able to describe harm reduction theories and apply harm reduction principles. And then the Canadian Council of Registered Nurse Regulators also states that in the clinician role, students, well, nurses must incorporate harm reduction principles into their plans of care. And that subsequently gets translated into entry-level competencies for all the provinces as well. So hopefully this makes the point that this is an expectation that nursing educators teach harm reduction and that students have working knowledge of harm reduction upon completion of their programs. All right. Megan, you're monitoring the chat, so I will just ignore it. You let me know if I need to do something.
Yes, absolutely. There's just some people with audio issues.
Oh,
So
really?
yeah,
Okay.
I don't think it's anything on your end. Yeah,
Okay.
it's all good. Continue.
Okay, no worries. Thank you. So all this led me to consider some questions here. How are undergraduate nursing students thinking about harm reduction in their practice? What's involved with how they're making sense of this? And what can educators do to enhance their readiness to practice harm reduction? So in order to answer these questions, I needed to first explore where nursing students were at in relation to harm reduction. So as such, this is my research question here. I wanted to focus on how nursing students who are about to graduate, how they conceptualize harm reduction in their practice with people who use drugs. So rather than a survey, I really wanted to get a sense of what students were saying about harm reduction and how they were saying it. So I decided on a qualitative approach. I did one-on-one interviews with some structured questions, but also leaving lots of room for open-ended discussion. All interviews were thankfully done. I got in just before the beginning of the pandemic, so they were all able to be in person. So it was quite well timed that way. I recruited participants by speaking to lecture classes and practicum groups in terms 7 and 8. So that is the last 2 terms before graduation from the undergraduate program. I also put up posters. They look like this. And the Faculty of Nursing here also circulated an invitation to participants to students that were eligible to participate via email. I had actually really great response. I was hoping for 10 and I ended up doing 11, so I stopped my recruitment at 11. The interviews were conducted on campus spaces and participants received a $5 Starbucks card when they showed up for the interview. So because of the purposive sampling approach that I used here, there could be some bias and limitations that we should consider. So students that were really knowledgeable about harm reduction or who cared about it might have been more likely to participate, whereas those who had negative perspectives or didn't know what it was might have shied away from participating. So as such, my findings aren't meant to reflect the perspective of all nursing students all over the place, but just to provide a starting point for further exploration. So I recorded all the interviews, I had them transcribed using AI, reviewed them for accuracy, and then I actually sent out the transcripts to the participants and had them review them. Now, I know that's not a very common step, but it was really important to me that students felt empowered to speak fully and engage with this topic. I got great response from the participants by doing this, and many were expressing gratitude for the conversation and for being part of the study. So then I used NVivo 12 to code and analyze the transcripts, and I'll share more about that shortly. And then I created a thematic map, shared it with the participants. Unfortunately, by that time, most of them had graduated and probably weren't checking their emails, so I didn't get a great response to that part of things. Here is my participant sample of my 11 participants. So the gender ratio was fairly typical of the nursing profession here. However, the age range was pretty varied, but many of them in their 20s, as you can see. Participants identified as mostly white or Caucasian, 2 as other, and they were able to select more than one ethnic identity I would have liked to have seen greater representation of like Black, Indigenous, and people of color, but this is a limitation of this type of sampling. Also note that this is a small sample size here. It's recruited from a single university, and the lack of like gender diversity and ethnic diversity means that the findings may not reflect the understanding of all nursing students. You can also see on the right hand side here that several students had prior post-secondary education here. So those were the previous degree holder students, and the most expected to work in an acute care setting, although several had interests in other areas as well. One thing I do kind of regret not collecting information about was where they originated from. Like, were they Albertans? Were they from out of country? Were they from a different province? Because I feel like that might have played a role as well. So I approached the question from a critical social theory lens. I felt this was an appropriate way to come to this research, because talking about drugs and the people who use them can elicit some pretty strong opinions that are sometimes rooted in racism, fear, stigma, discrimination, issues of morality. So that means that I prioritized self-reflection in this process, both of myself and of the participants. So as we were talking, we would reflect on what we were talking about and how we were talking about it, and why we used the words that we did. So just following this flowchart here, once I collected my transcripts and memos, I familiarized myself with the data, made some codes. This was a whole thematic analysis process from Brown and Clark. It's not linear. It kind of goes around back and forth, and I had to go back a few times and reassess a few things. But the point here is that the themes don't just emerge, they're actively created by myself, by me. And because it's a thematic analysis, I did have some outline data to contend with, but I tried to focus on what was going on for the majority of people. So it doesn't include everything that was said, but some of the major themes that emerged, that were created. So that's the research design. Let's get into the themes. So I developed 3 major themes here and 9 sub-themes. So there's some ovals in the map here. So they're concentric circles represent the domains of the themes. So the interplay between them is indicated by the dotted lines around the innermost 2 circles here. So the smallest one is the conceptual. That's the understanding of the concept. The second one here is the contextual. So that's how our understanding is being influenced by the social context. And then both of these are also being influenced by the critical societal issues, which is the final largest oval. So I'm going to go through these in more detail. First, you'll hear me speak about the ideas and themes, and then I'm going to have some participant quotes to bring to life some of these thoughts. Note that the voices you will be hearing were generated using artificial intelligence, text-to-speech functions, using ChatGPT-4. So any similarities to real persons or my participants are totally unintentional. And the participants also selected their own pseudonyms. So that was to protect their anonymity in this as well. So the first theme, the innermost circle here, is that conceptually, participants were easily able to make connections between harm reduction and nursing practice. And the majority expressed a reasonably developed understanding of the concept. And this surprised me a little bit. I wasn't sure that they had enough exposure to this to really be able to speak to it, but they did. So first is that harm reduction is congruent with nursing concepts. Participants recognized that harm reduction and nursing practice shared many key concepts. I think it's a good example of how harm reduction fits into nursing quite naturally, as one participant put it. Some of these concepts that participant thought crossed over from harm reduction are like talking about safety, talking about patient-centered, holistic care, ethics, the role of the social determinants of health, trust, relationship building, health promotion, all that sort of stuff. So let's hear from our participants on this side here.
I think it comes down to just how we're taught things, and the client first kind of approach just sort of leads to harm reduction, I think, quite naturally.
I definitely think harm reduction falls under the category of health promotion, because promoting safe drug use, promoting safe sex, all of those things, promoting safety measures for activities, they all fall under promoting population health.
So hopefully that makes a little bit of sense. The other sub-theme here is that harm reduction is inherent to nursing practice. Participants asserted that harm reduction is not new to nursing, and that nurses have actually been practicing harm reduction for a long time in applications well beyond substance use and addiction. So there was some discussion about how the term harm reduction might be new to nursing, but that as a concept, it isn't new because it's just an extension of health promotion and disease prevention. So participants were able to discuss harm reduction in the context of various other activities involving risk, such as sexual activity, sex work, as well as helmets for bike riding, seatbelts for driving, that sort of thing. So some participants even applied the idea of harm reduction to the care of people with diabetes, or to those that could be exposed to secondhand smoke. So let's hear what they had to say about this.
If you think of harm reduction in the general sense of the word, don't we do that all the time?
I think harm reduction is an essential part of nursing because it's all in that health promotion and prevention area.
So this theme to me indicates that these students had actually a good grasp on harm reduction and how it applies to their nursing practice. I did not perceive that the actual understanding of the concept was an issue for them. As we move to the next theme, we'll see where the issues come up with conceptualizing harm reduction in their practice. So the second theme involves the contextual. So that is how the participants are navigating their socially constructed values, beliefs, and experiences related to drug use and the people who use them. So this can also be understood as sort of the participants' inner world. What's going on inside their heads, what stories they're telling themselves about the world that they live in. This is happening inside, but much of it is based on what happens on the outside, such as if you witness poor treatment of someone who uses drugs, or you're hearing stigmatizing terms. So navigating these internal ideas cause some tension for participants. And I divided this into 4 other themes, sub-themes. First being, how do nurses understand drug use? So let's hear from participants about this one first.
People want to believe that it's the person's fault for being there, instead of assuming that there could be some external societal or other pressures that may have led them there.
People who are using whatever substance, they might be suffering. And for them, that's a coping mechanism that's working for them in that moment.
So participants held various beliefs about choice, autonomy, and morality when it came to drug use and addiction. And then this informed their approach. So they understood addiction and reasons for drug use in a whole variety of ways, some discussing it as a brain disease, sort of like mental illness, and some described it as a maladaptive coping skill, and others saw it as a result of external influences such as poverty. I noticed that participants didn't seem to have a unified or consistent understanding of why people use drugs, but their perspectives were informed by their personal values and beliefs rather than their professional education at this point. The next one is the participants were thinking, how should nurses care for people who use drugs? So many of them described witnessing discrimination towards people who use drugs, no surprise there, from healthcare providers. And they're trying to envision how they're going to practice with people who use drugs when these stigmatizing attitudes are so pervasive and difficult to address. So I heard, unfortunately, countless stories of judgment and discrimination from nurses towards people who use drugs. And participants were trying to reconcile what they were observing with how they wanted to care for people who use drugs. Several participants brought up some well-known phrases like meeting them where they're at, but it became clear that there was more to consider in the care of people who use drugs, particularly as professionals. So let's listen to our participants here.
And the nurses were saying, don't even bother talking to him. He's not worth making your care plan about, because when he leaves, he's just going to use meth again. He's a meth head.
And I'm sure we've heard some of these sorts of stories.
I think as care providers, we have this power and responsibility to make that effort, to make those bridges so we can collaborate and make the life of the person we're trying to help a lot easier.
So there is some understanding of, how should I go about doing this as care providers? What is our understanding, and how does that jive with what we're seeing as students in our clinical settings? So the third theme in this area is, does harm reduction complicate nursing care? Participants expressed that harm reduction care could be uncomfortable because it creates ambiguity in the expected outcomes. It disrupts any established nursing routines, and it could contribute to burnout in nurses. So many participants also discussed that there might be uncomfortable ethical concerns and dilemmas involved in providing harm reduction care. I heard participants expressing how difficult it would be to set aside their ideas of what they believe to be best for the person in favor of taking a patient-first approach. Nurses are well-versed in health promotion, and they want to feel like they're helping solve people's problems. So harm reduction complicates this a little bit, and nurses and people who use drugs may not always see eye to eye on what the goals of care should be. Let's listen to some quotes here.
It's so tricky because there's so many of these drugs that can be so harmful. So that's where it gets complicated. You don't want to make it like, this is okay, but it's not okay. I don't know where the line is.
I think that you have to be very flexible. I think that can be challenging to people. You're doing this to yourself, and we're just wanting to help, but letting it go, that's hard. There's a bit of burnout or a feeling of hopelessness.
I don't think that our instructors put us with those patients in the hospital, because those tend to be the more complex patients.
And I think for any of us who work in clinical settings, I think we can relate to this a little bit. That it's not as straightforward sometimes, it's not as routine. All right, so the other thing that students are trying to make sense of here is, why aren't nursing students taught this? So participants voiced that there was a lack of exposure to people who use drugs, a lack of exposure to harm reduction, to illicit drug information within their nursing education. And this perpetuated this belief that the care of people who use drugs was not important. So they expressed wanting to learn more about the effects of specific drugs and what's important to assess in someone who presents for care while under the influence. Most participants felt that they had not gotten enough direct exposure to people who use drugs to feel confident and competent in that area. So let's hear what they had to say about that.
Why would we waste precious education time on someone who chose to do this to himself anyway? I never think that would be explicitly stated by anyone developing curricula or anything, but I think it's implicit enough.
I think learning has to come with personal experience and exposure to the benefits of harm reduction firsthand, and then also exposure to those people that are potentially stigmatized.
All right, so that's the contextual. Now, this final theme relates to how participants are navigating external forces that they perceive to be out of their control. So external systemic forces influence the participants' actions and perspectives towards people who use drugs and harm reduction. Participants were both consciously and unconsciously negotiating these systems as they discussed how harm reduction relates to their practice. Within this area, I came up with 3 sub-themes. First one being that the established systems are oppressive. Participants perceived a multitude of oppressive hierarchies and power dynamics, leading them to feel powerless as students and as new nurses. So I heard a lot of stories about oppression and power, often related to ageism, sexism, and the medical hierarchy, doctors, nurses, etc. Many participants felt that they were being that they were contending with compounding social disadvantages in the workforce, such as being young, being female, and being nurses rather than doctors. But let's hear what they had to say about this.
Know your role and shut your hole.
Pretty straightforward.
Parts of us are a bit angry about the things that we see. Yeah, and that we have no power over changing as students.
I did have that knowledge and I wanted to say something, but as a student nurse, I can't. And so I stayed quiet, and there was that shame and guilt.
So this is a little hard to hear, I think, as an educator, right? We're trying so hard to create a next generation of leaders and advocates. And so I think it's important to recognize that there are these larger oppression and power dynamics that students are contending with. The other thing here is that disrupting systemic norms is pretty unappealing. So participants felt that expectations for nurses were out of balance with the workload, and that taking on, social political challenges would be unrealistic and undesirable. They described wanting to fit in to their workplace and not wanting to rock the boat if they were to, speak up in support of something controversial like harm reduction. So let's hear what they had to say there.
How am I going to remember that I want to make change when it's really hard just doing my job?
It's overwhelming right now because anywhere you look, there's like, this is a problem. This is a problem. This is a problem.
I think we can relate to that as well. As nurses, there's just so much that needs our attention, and it can be a little overwhelming for sure. So the third and final theme here is that participants did seem to recognize that nurses can be a force for change. And participants expressed that nurses could be leaders if they were willing to recognize and use their power as individuals within that professional collective. They expressed a desire to see nurses become more politically active and felt nurses have a lot of advocacy work to do in this field. So given that lots of my sub-themes here do have somewhat of a pessimistic, negative angle, I felt it appropriate and necessary to include this more optimistic one. Despite all the challenges that nursing students face and that the field of harm reduction faces, I found evidence of hope, resilience, perseverance. Nursing students are clearly being exposed to these bigger ideas of political advocacy and system change. And while they may not feel it's immediately applicable, it appears to have become part of their professional identity. So let's hear from them on this.
I think it's really important for nurses to be aware of harm reduction so they can advocate not only towards people who are outside of the profession, but also within the profession. And then hopefully lobby it to governments because they are who gives us money.
Ain't that the truth?
How many RNs are there in politics? I don't know the answer to that, but I feel like that's just not a career path that many people think of. We are leaders in our small healthcare community, and it is a very trusted, respected profession, but it's not being used to that political side, maybe as much as it could be.
I think that there's a massive role for nurses in that kind of advocacy work. I think it's one of the things they address in the program, the ability for nurses to be change agents on a larger scale.
So that's the final theme and sub-themes. Students are actively negotiating the systemic dynamics, which are so much bigger than harm reduction, and will likely affect their entire experience as nurses and new nurses, or as students and new nurses. So that brings it full circle. I hope this diagram is helpful in illustrating how these themes fit together and inform one another. So participants generally understood the concept of harm reduction and how it applies to nursing care. They were unsure of how they might provide that care due to their personal values and beliefs. On top of this, some larger systemic dynamics are at play, which also influence how the participants might engage with harm reduction in their practice. Now, what does this mean? Well, what are the implications here? So these results indicate that while some areas of the undergraduate curriculum could benefit from being updated for sure, students' conceptualization of harm reduction involves more than just the learning of lecture content. So I've distilled 4 recommendations here based on the themes I identified from my conversations with these students. And I'll share some examples of what each of these could look like in practice, many of these from my practice. I know that some of this is already being implemented to some degree in institutions, and I'd love to hear from the audience as well about what this is looking like in your classroom or in your program or in your clinical placements as well. So these are the 4 recommendations here. So curriculum content should be adapted. Educators should emphasize critical reflection. We should prioritize exposure to people who use drugs. And we need to teach from a socio-political perspective. So I'm going to go into each of these in more depth. So first, regarding curriculum, it would be appropriate to include some content about the effects of illicit drugs in their clinical presentations. This can be first addressed in maybe pharmacology and pathophysiology context, but it could also be weaved into a variety of other semesters or terms. Of course, this should reflect the best available evidence and be relevant to current drug trends and evolving drug policy. This could be done by having a guest speaker with expertise, perhaps from the faculty or beyond, as appropriate. There's also many online resources and videos that can help bring this content to life for students. I also find this is a really great opportunity for interprofessional educational activities, such as gathering students from, say, nursing, medicine, social work, for example. So last month, I was invited to teach this particular content to social work students at another university, and I brought my own practicum students along with me. It was so insightful to have that shared learning experience and compare notes about how it applies to both nursing and social work practice. I actually even had my students co-deliver the naloxone training component, and this really increased their retention of the material and comfort with the skill. I also love using current events as discussion pieces. So, you know, what do we know about the illicit drugs currently circulating in our city? What do we not know? What isn't being said? For example, what does the presence of xylazine mean for drug users and healthcare providers? How can the peer-reviewed and other reputable literature inform our approach to care? So those are just some ideas here. The next recommendation is that beyond curricula, to teach harm reduction impactfully, we also have to explore, the students have to explore their understanding as individuals into, you know, what drug use means to them and the role of harm reduction. So I know that self-reflection is already a huge component. It's a focus in undergraduate education for sure. Taking a critical lens and exploring some of those contentious topics, such as drug use, would be valuable for students. So I love using anonymous classroom tools like Kahoot or Mentimeter to solicit students' ideas and assumptions about drugs and the people who use them. This sparks wonderful guided discussions about ideas of stigma, bias, values, determinants of health, and can help identify some knowledge gaps as well. I also encourage students to be candid in their weekly reflections, in clinical anyway, and to, you know, or post conferences, debriefs in a clinical setting. And to reflect on the complexities of what they're learning when it comes to harm reduction and people who use drugs. One of my favorite harm reduction learning activities is that, and I do it every term, is having students connect harm reduction with a behavior that they themselves engage in that carries risk, such as maybe driving, going backpacking, horseback riding, you know, extreme sports, weightlifting, drinking. Have them write down by themselves individually what the risks and potential harms are of engaging in that activity. And then have them think about how they minimize those harms when they're going to engage in those activities. I then put them in pairs or groups to teach their peers about the activity and how to stay safe as possible while doing that activity. So this activity works really well to enhance understanding by linking harm reduction to their personal contexts. And it's also a good idea to discuss the futility of an abstinence-only approach. Try telling the students to simply stop whatever behavior and see what kind of reaction you get. I find this one's really fun, and you also get to learn a lot about your students as well. So there's some ideas for that one. The third one is that clinical exposure to people who use drugs should be prioritized rather than avoided. And students should be supported to navigate patient care through that harm reduction lens. So obviously in clinical placements, that means that students should be assigned to patients who use drugs as regularly as possible. I mean, as with any patient, if there's concerns about safety or boundary violations, maybe have students pair up to plan and deliver care for that patient, maybe even with an instructor or a mentor present if that's a concern. Clinical exposure to people who use drugs could also be explored using simulation technology. For example, a sim patient experiencing an opioid poisoning or in withdrawals, or even just a post-operative patient with a history of substance use. Consider using generative artificial intelligence text-to-speech capabilities to yield more realistic results in these simulation environments. Another wonderful way to increase student exposure to people who use drugs is to invite speakers with lived experience with drug use to come and share their experience. You can often access these individuals by connecting with local shelters and harm reduction organizations. A highlight for one of my student groups this past term was actually conducting a focus group at the drop-in center with some of their residents. So that's our biggest local shelter here. Of course, as with all lived experience speakers, do compensate them appropriately. And it's a bonus when these speakers can also provide information about the local harm reduction scene too. Another more like arts-focused activity that could support students to develop empathy and imagine a perspective different than their own is perhaps have them select a song about substance use from artists with known history of use. So if I'm thinking like Amy Winehouse, Eminem, Red Hot Chili Peppers, etc. There's a ton of film options as well. And have students explore the meaning and feeling of the song while considering some key questions such as like, what's going on for this person? What's being said? What is not being said? What determinants of health might be involved for this person? How might you support this person if they were your patient? What assumptions are you making? And what would a harm reduction approach look like in this person's context? All this with the aim of exposing students to different perspectives, different experiences of drug use and the harm reduction approach. The last one here is that as students transition to independent practice, an explicit focus on teaching harm reduction from that socio-political perspective will support them to assess and recognize situations where their advocacy is needed. So for this one, I actually think a well-designed critical reflective assignment, like a paper, goes a long way. So for example, a well-designed, for example, have them come up with some common drug or harm reduction related myths or misconceptions. And you can actually, the AI chatbots do this really well. So some examples are like, harm reduction encourages drug use, or drug addiction is a choice. Then they select one of these statements and consider why someone might hold this view. Then they explore the peer-reviewed literature to determine what the evidence actually is for that statement. Finally, they can write themselves a script of sorts of how they'd approach that discussion with a colleague who held that particular view. And this is helpful in, translating that evidence, but also using appropriate communication techniques. So I know many of you already have assignments and papers in the realm of social justice issues. And I think that's also a great place to encourage students to explore issues from that socio-political perspective. What else? Again, current events can help spark discussions about how the larger social issues affect people who use drugs. I recall one term having a lively debate with my students when we attempted to assess and evaluate BC's decriminalization pilot program last year. That was very interesting, still is. I've also shared some of the position statements. Actually, maybe I've shared the HRNA position statements before for students to see what nursing advocacy can look like on these larger issues and how they could get involved with issues that matter to them and their patients. So this recommendation also supports several of the entry to practice competencies related to advocacy, equity, and social justice. that nursing students are expected to have when they graduate. So these are just a few examples. Please do share your favorite harm reduction related activities or assignments. I'm always looking for more. I find that really interesting. And I think that is it. Thanks again for listening. Super grateful to have the opportunity to share my thesis work here. I'm happy to answer questions and discuss ideas about how students in the nursing profession can be better prepared to practice harm reduction. I'm always happy to answer emails as well. So there is my email, and I will hand it back over to Megan.
Thank you so much, Dominique. I'm just going to stop the recording here.